Hello, everyone, TVMA members. My name is Trent Hightower. I'm the general counsel at TVMA, and we've convened a group here to talk a little bit about a topic that is a big issue that's going on legislatively. It was a big issue last session, and we expect it to be again, and that is chiropractic in veterinary medicine. So we had a work group consisting of several veterinarians who practice in this area, take a look at what the use of chiropractic is, what do veterinarians understand about it, what do chiropractors understand about it, how does the law work, because there are some legalities that veterinarians need to be aware of, as well as the clinical side of when to use chiropractic, when it's responsible, how best to use it, and when not to use it. So I want to kind of just briefly introduce each of our panelists today. They did this discussion at Southwest Vet Symposium in September, and it was very well received. So we wanted to offer it to TVMA members online too. So we'll start, let them each kind of introduce themselves and talk a little bit about their practice and what they'll be discussing today. So Dr. Barton, let's start with you.
Hi guys, I'm Dr. Barton. I'm a Model 2001 graduate from LSU. I'm also certified in acupuncture and 2 separate rehab certifications, as well as IVCA certified. I'm the owner of Heal Veterinary Hospital and have been actively practicing in the holistic and alternative realms, integrated with standard medicine for the last 12 years solely. So definitely have a big invested interest in how we handle all of our kind of geriatric and mobility challenge patients.
Excellent. Dr. Hites.
I am Suzanne Hites. I have been a veterinarian for over 32 years, so I'm a 92 model. So I have also been certified in animal chiropractic since, oh gosh, so 25 years. And I learned from the founder and developer of animal chiropractic, that would be Sharon Willoughby. And I have owned my own practice for the last 25 years. It's called The Whole Pet. It encompasses 3 different states, so Illinois, Texas, and New Mexico. I have lived and practiced in all 3 of those states. And I solely do integrative medicine. I don't do any of the regular medicine, but I use chiropractic, acupuncture, all the holistic modalities every single day. That's all I do.
Excellent. And Dr. Smallwood.
I'm Jennifer Smallwood. I graduated from Texas A&M in 2003. I am an integrative practitioner in the DFW area, certified by the International Veterinary Chiropractic Association. I have a master's in Chinese medicine, and I own 2 practices up here, one in Richardson and one in Louisville.
Excellent. Well, thank you all for being here. We really appreciate all the work you've done on this topic. And I think we're going to start with Dr. Hites. So you can take it from here.
Great. Thank you very much, Trent. So my part of this discussion is to talk a little bit about what chiropractic is so that everyone is familiar. I know we had some great conferences some great topic discussion at Southwest, but I just want to review everything for you guys. So first, we're going to talk about what different names animal chiropractic can go by. So the most common one is animal chiropractic, but you will hear other things said, such as animal manipulation, adjustment, mobilization. They are technically slightly different, but many people use them the same. The biggest one you will start hearing now is veterinary spinal manipulative therapy, or VSMT. And the reason we're starting to hear that from some states is that the word chiropractic in some states is a protected word, meaning it only pertains to human medicine. And so some states do not allow veterinarians or non-DVMs to use that word. So that's so you don't get confused. Those all mostly mean the same thing. So basically, we're going to talk a little bit about what chiropractic is. You will hear many of the chiropractors discuss we are looking for a vertebral subluxation complex. And that is what this is. This is a very complicated slide, but basically what I want to show you is this is going to be normal right here where my vertebrae, the bones are meeting normally, my nerve can get all of its functions out. And this is what happens when we have a vertebral subluxation complex. It's just moving by a millimeter or two, or it's just not sliding and moving properly. And so that's what they, as chiropractors, are looking for. But I want to show you where this is. So you can see my spinal cord is right here. So this is why it is so important to make sure we have people that are properly educated and know the differences in all the different breeds and species so that we are not harming this amazing structure right there. So this is a up close and personal model. This is called the motion segment. It is the basic unit for chiropractors to work with. We have our two adjacent vertebrae joined by our disc, and then we have our facet joints up here, and then you have all your associated ligaments and muscles. And then again, you see how close my spinal cord is. So very important to know what we're doing. The reason chiropractic can be so useful and why people will seek you out just for maintenance therapy is that we want to prevent any fixations. So they have done studies to show that after 8 weeks of fixation of the facet joints in the spine, degeneration already exists. And we certainly don't want that to happen. And so we want to keep them adjusted. So as you see adjustments up here, this is a very busy slide. So I gave you a nice slide of the Swiss Alps over here to keep your mind calm. But this is all the pathophysiology that we will go through. So up here is just where the bones are not sliding properly. But you can see if they're not sliding properly and moving properly, we get into all these other facets with your nerves, your muscles, your connective tissue, and your vascular systems. And then we start getting all these other issues. And that's why chiropractic can be so powerful. And we need to make sure we are all doing the right things. Okay, so the neuropathology. So you can see, we all know that the segmental nerves or the spinal nerves come out right between those vertebrae. And if you have degeneration of those articular facets, it's going to influence my spinal nerves, right? We're going to start affecting the way that they can release their neurotransmitters. They have even found that the joint capsule stretching right on between those joints, that joint capsule stretch can actually weaken your quadriceps muscles, and then your neurotransmitters. So a normal nerve is going to release a normal amount of neurotransmitter, and it'll go to its proper place. But a nerve that is not able to get its functions out properly are going to be inhibited. So either it's not going to release a normal amount of neurotransmitter, or it's going to release it in an abnormal area, or it's not going to release at all. So myopathology, you can see that the joint manipulation, we all know that disuse atrophy occurs when joints are not moving properly. So we see that easily when we look at dogs with hip dysplasia. So hip dysplasia, we all know those legs are not moving properly. You start seeing atrophy of the muscles down the legs. Very easy to see. That also happens up in the spine. And so with decreased movement, there's less oxygen and nutrients going through my joint fluid. My joints start having problems. You will also have muscle spindle cells having problems, and they will show degeneration when you look at them microscopically. Connective tissue will also have issues where you will have your joint immobilization will lead to stiffness and contracture. We've all seen those dogs whose spine look like an S shape rather than a nice straight up and down shape. You will also have your synovial fluid. First, it starts condensing down, and then it starts having fibrous adhesions in it, and then you eventually will get those bone salts being deposited. Your articular cartilage will shrink. It loses its proteoglycans, and then it can actually develop little ulcerations. And your ligaments. So ligaments initially will start to try to increase your joint play when your bones are not able to do their normal movement. Ligaments will like, hey, I'll help out. And initially that's a good thing to have happen, but then they get overworked. They're not used to doing that much work. And so then you will start having problems with them breaking down. Vascular problems, they've actually found that vascular problems can be seen earlier than nerve issues. So again, this is important why chiropractic can be used more in maintaining health, is that if I can keep things moving properly, I'm not going to have get to the point where I'm having nerve issues. They found that if they can just occlude the spinal artery, they can already start seeing joint stiffness before we have any nerve issues. And what causes the occlusions of those arteries are going to be your normal disc protrusions, tumors, osteophytes that you get along, spondylosis will do it, the bony hypertrophy. Then we also have to look at the vertebral venous drainage. It's a little bit different than other venous drainage in the body, whereas it has no valves whatsoever, which means that if one spot is not working and toxins start building up, it can flow to the whole spinal cord. So that makes it important to make sure that we are getting rid of these, areas that are not functioning properly, so we don't get buildup. And then if we do not release these things and we're having those four, your muscles, your connective tissue, your vascular issue, and bone issues start, that will eventually lead to your inflammatory response, your histopathological response, and biochemical changes. So manipulation affects the entire body. So often I will hear when people are trying to defend or, say, hey, it's just I'm moving a couple bones. It's not just moving bones. You are having an effect on the entire body. So again, it is imperative that we have people that are properly trained. When we look at vertebral or veterinary spinal manipulative therapy, we're looking at the kinematics and how this works. So this is active range of motion, right? Everybody remembers this. That's how far you can move back and forth yourself. Passive range of motion is when I go as far as my active range and then I can push it farther. That's passive range of motion. And then I come up to something where I can't push any farther. That's my elastic barrier. So the chiropractic adjustment actually occurs in the periphysiological space. And that is right after this elastic barrier. So it's just another millimeter or two past. And that is where your adjustments occur. So, but you can see that right after that is where your anatomic integrity happens. So if I go past my elastic barrier, then I'm going to have actual tissue, bone damage, and most likely nerve damage. And so it's vitally important that we make sure that we are all adjusting properly to the proper depth and force. And again, this is where education becomes so important, and that some standardization needs to start happening so that we make sure we all are adjusting properly for each patient, because there's a big difference between a golden retriever and a pug, right? So it's very important that we make sure that we realize where we're adjusting, how hard we're adjusting, how fast we're adjusting. So chiropractic theory is based on the diagnosis and manipulative treatment of the misalignments of the joints, mostly of the spinal column, but you can do your rest of your skeleton as well. And so it's focusing on the relationships between your nervous system and the spinal cord. And we basically are removing any nerve interference so that my nerves can do their job. I like to look at it, how I explain it to a lot of people is that it's kind of like there's a traffic jam on the highway, and that's those bones that are not moving properly. And I go in there and I make the traffic jam go away. So then traffic can flow again, and that's my nerve function being able to flow again. So again, far-reaching changes throughout the body. It's not just some bones that we're moving. So specific definition of veterinary spinal manipulative therapy is it is a high velocity, so very fast, short lever, meaning I am going, if I'm adjusting this joint here, I'm touching right here. Low amplitude force. You do not need a lot of force. We all took physics, force equals mass times acceleration, right? So if I am fast at my adjustment, meaning it's a speedy adjustment, I don't have to put a lot of mass in there. So it's applied to a very specific contact point on the axial and appendicular skeleton. And it's got to be very precise. And this is where we are being precise. So if we look, then these are some of our contact points that we adjust. So I have my spinous process, I'll adjust here, or on my transverse process, and then some of our adjustments are right on the vertebral body right here. But again, look what's right here, my spinal cord. So it is vitally important we make sure that we are adjusting properly with the proper force so that we are not hurting our spinal cord. So we have to be able to as practitioners of this modality, we have to know the unique anatomy of each of these breeds and species. Like I said earlier, there's a big difference between a golden retriever and a pug, who's in this lovely picture here, a pug. We have to be able to know the differences between them. We also have to be able to recognize the pathology of the neuromuscular system. Lots of things look like they might be nerve issues and they're actually not. So we have to know how other things affect our patients. You have to recognize when this technique is indicated and it's going to be beneficial, but we also have to be able to recognize when the technique might be harmful or it's going to be of no benefit to the particular patient and what their pet parent is bringing them in for. So what kind of people come in and receive chiropractic with me? We have our competition animals. You've got your dogs that do agility and fly ball, lure coursing, dock diving, and barn hunts. And then we also have our horses. You've got barrel racers, regular racing, around a loop course, and you've got roping and dressage. Then you've got your show animals. You've got your dogs, your cats, and then we have to think about 4-H animals, right? We've got horses and cows and pigs, and this is how these students earn money for college. So it's very important that everybody is moving right, and it does make a difference. I have had several come to me and they're like, this show dog used to win and just is not moving right, and all I do is adjust them, and then they go in and win, and their owners are quite thrilled with that. And then we have our recreational animals. You've got horses that are just trail riding horses. You think of the horses that, take people, down to the Grand Canyon and such. They've got to be adjusted properly. You have different people riding them all the time. So we have to keep their backs functioning. This is how people make their money with these animals. And then think about your military working dogs. I lived in Las Cruces, New Mexico for many years, and right by White Sands Missile Range and Fort Bliss. And so we worked with a lot of military dogs. They have to do their job. Very important work that these animals are doing. And then you think about your service animals. It costs a lot to make these animals, function for these people, and these people are relying on these animals. So we have to keep them working as, up to their best ability. Then you've got farm animals and ranch animals. They have to be able to do what their work is as well, because people are counting on them. And then you've got your everyday patients. I do see probably 50% of my patients are an older crowd, and they are coming in because they're not working, not able to get up on the couch, get in the car, go on their walks anymore. So a lot of them do have osteoarthritis, and this is one of the modalities that can help with certain patients. And so a lot of patients will also have concurrent disease, so they can't be on certain medications or they can't have a surgery. And this can be a beneficial modality when it's used properly. So I have talked to you a little bit. That was a very quick overview about what chiropractic is. Now I'm going to go through what it is not. So it is not scary. It's not painful. It's not like TikTok. So I have never had an animal turn around and try to bite me when I have been adjusting it. I'm a pretty gentle adjuster, but I'm very effective, or I wouldn't still have a job after 25 years of doing this. But it doesn't have to be painful. And so I really cringe at those TikTok videos, because that's not what I do for a living. Other things that chiropractic is not: it is not laser. It is not rehab or exercises. It's not acupuncture, dry needling, trigger point therapy, anything that anybody wants to stick a needle. That's not chiropractic. It is not electrical stimulation, so it's not TENS or electrical acupuncture. It is not orthopedic devices, measuring for or placing braces, splints, or a mobility device, like a help 'em up harness. None of this is chiropractic. It is not massage or fascial work or shockwave. And when I say this is not chiropractic, what I'm meaning is that none of this is taught in the animal chiropractic courses. So thus, anybody that has only gone through these courses, they do not have the ability, or the proper education to be recommending or doing any of these procedures. The other things it does not include, it does not include any nutritional advice or supplemental advice. So nothing about, oh, you should be feeding this food or raw or anything like that. No supplements, homeopathics, botanicals, vitamins, minerals, your nutraceuticals, anything for the joints. None of that should be discussed unless you are also trained in that modality. Traditional Chinese medicine, PEMF, ultrasound, whether it's used for diagnostics or for therapy, that is not chiropractic as well. Hydrotherapy, that is not included either. So you have to have specific training in any of these modalities. So hopefully I have given you a little bit about what chiropractic is and then what chiropractic is not. And then we will move on with Dr. Barton now, and she will go on with our discussion.
So I'd like to talk a little bit about just the animal chiropractic education, because I think it's important that veterinarians kind of understand like what these people know, right? Whether it's other veterinarians that are offering chiropractic care, or whether it's a human chiropractor who is using this to, expand their business. So there's a differential between chiropractic certification and the chiropractic continuing education. So the first thing we have to do is attend one of the continuing education programs to be eligible for the animal chiropractic certification. So it's something that's actually separated from that foundational, education process. So what does it mean to be certified? So again, it most often is going to reference either the AVCA or the IVCA. These are the two major entities in the United States that hold kind of these separate professional certifications. So ultimately, people are going to be looking at this to try and kind of show and validate their skill set. So when we go back another step and look at the continuing education courses, these are the major ones that we do have here in the States. Currently, only Options and the Healing Oasis are recognized by the IVCA certification process. All of these that are listed here are recognized by the AVCA certification process. So basically, if you took and completed one of these foundation education courses in animal chiropractic, you're eligible to go sit for the testing for AVCA or IVCA certification. So what is certification? Is that different than accreditation? What does it have to do with regulation altogether? So ultimately, it's important to kind of realize that they're not the same thing. And many chiropractors really do view the AVCA and the IVCA testing process as kind of like their board certification, because they're referencing the nonprofit board that's in charge of kind of designating and executing these education courses. They are not referencing the TVMA. They're only referencing that nonprofit board. So we need to kind of understand that. So when they say that they're board certified, it doesn't mean the same thing that we as veterinarians tend to understand when somebody references that. It's also very important to understand that, the educational and testing processes are solely determined by that individual nonprofit group and have nothing to do with, any of our veterinary boards. So just to kind of unpack the differential here, we all know this already. So when we're referencing accreditation, we're really talking about, things that are validated through the AVMA Council on Education. And so just to look a little bit about our education qualification for veterinarians, the NAVLE, it's made up by two different board groups, basically. So the International Council for Veterinary Assessment plus the National Board of Medical Examiners. And so through that and a professional practice analysis is how our NAVLE is developed, and thus how the Council on Education creates, guidelines for what we need to learn in vet school. This is not what happens as far as, the AVCA or the IVCA certification. Now, it's not to say that it's not worth anything, right? Because at least they are trying to help set a certain standard for chiropractic education. But I think we have to look at like what their goals are. Why do they exist? Ultimately, they're setting their own standards, and there's really no other third-party input on the quality of education. And ultimately, who benefits from the type of standards that are set? Because there's not a lot of consistency. There isn't a tremendous amount of clarity even on agreed foundational tenets. There's a big differential on the safety of the practitioner's ability and control of force. Certainly in some of the continuing education courses, they do practice the actual adjustment and assess for control of force. But then there's others that never allow you to adjust until you're completely through the course. So what are the ethics associated with being an animal chiropractic practitioner? What are the best practices? And ultimately, like, what's the overarching regulation? So these are a lot of the questions that I think we as veterinarians need to kind of start asking, especially in looking to choose a practitioner that we want to partner with. So let's unpack the education a little bit more. So let's talk contact hours or continuing education hours versus college credit hours. So postgraduate, we have continuing education. That's all going to be reported in contact or physical hours. So when we start looking at those CE hours or their contact hours, they're not equivalent to a college credit hour. So just to understand the math a little bit, a college credit course that is 1 credit hour is equivalent to 45 contact hours. So for reference, a veterinary degree requires about 165 to 170 credit hours. So this is equivalent to, about 7,400 contact or actual physical hours over 4 years. Now, when we start looking at how they do their math, ultimately we kind of allow, 1 credit hour per week, 15 hours, but then they also allot for the expected work outside of that physical class to equal about 30 hours. And so that's kind of how they come to this math. So when we start looking at the contact or CE hours that the AVCA and the IVCA certification kind of require to be valid and sit for testing, if you look at like one particular program, about roughly 213 hours. So of that, 34% are online, 30% are also just labs and examinations. About 31% of it is equine, 27% is canine, and about 31% is chiropractic theory. So when we start looking at that 213 hours and you start looking at the lecture and the core material, that's going to equate to about 3.3 college credit hours. The labs equal about 1 credit hour. So ultimately, if you look at the main chiropractic foundation education courses, it's roughly an equivalent of 4 college credit hours. So ultimately, this could be kind of considered, an elective in some of our, professional degree tracks. And is that enough? Is that enough for someone who is not a veterinarian to be able to kind of cross those legislative defined industries? And if so, should they do it with supervision? Should they do it without supervision? Should they do it at all? So let's look a little bit more on the training versus the clinical practice. So DVMs trained in animal chiropractic, we have this animal chiropractic education that's added to our DVM foundational training. So all it does is expands our tools in our toolbox. We have expanded clinical judgment. We still have a prioritized sense of first do no harm. We have the ability to decide if this therapy has a really good ability to help this pet. And more importantly, making sure that the therapy that we're going to choose doesn't have the potential to cause harm. We have choices for other therapies if it's not appropriate. We can choose diagnostics. We have the ability to refer to specialists if that's necessary as well. But if you look at what a chiropractic has when they have that additional animal chiropractic education, it's added to their human chiropractic education. So what other options do they have? They can either do a chiropractic adjustment, or unfortunately, they're faced with kind of practicing outside of their scope of practice. Are they willing to walk away if an adjustment's not in the best interest of their patient? Can they recognize when animal chiropractic is not in the best interest of their patient? And I think that comes back to, what education do they have? What course did they go through? How well did that course really help chiropractors recognize, when contraindications are present? I will tell you that for the most part, the chiropractors expect the vet who's, referring to them or actually supervising them here in Texas to actually screen these patients for the presence of contraindications before allowing them to start treatment. So we have a few cases that we want to kind of run through. So if you other guys want to kind of weigh in here, I believe that Dr. Hites, I think you had the cranial cruciate ligament insufficiency.
Yes.
Okay.
So often we will have patients that, seek alternative therapies for cruciate ligament issues. I get these calls often, and it gives me pause. The reason that people will seek, me out is because their dog either has multiple comorbidities. They're in heart failure, so they're not great surgical candidates. Or the owner, they just can't afford it, or the pet is just never going to be able to be confined for 8 weeks for like a TPLO where they're actually fracturing a bone. So they'll seek out alternative therapy, or they'll come to me and they go, oh my gosh, his back is hurting, he's limping again, it's his back again. They've been having chiropractic for years. And then if you show up and you're like, oh, it's really not the back, it's a knee issue. I've actually had some non-DVM practitioners that have seen patients like this as well, that then I end up getting involved as the secondary chiropractor. So if they show up, if a non-DVM shows up and sees a patient and they're like, yeah, I think it's the knee, they are not allowed to say, oh, it's a cruciate ligament, because they can't diagnose that, but they know that it's probably the knee. They go, oh, well, this is probably a knee. And they say, go back to your regular veterinarian for proper diagnostics and treatment. But my quandary is do they still adjust the animal then? So the owner sought you out just for this limping in the back leg that turns out to most likely be a knee problem, suspected that possibly is a cruciate, and chiropractic will not fix that. It will not fix a ligament that is either partially ruptured or fully ruptured. And so do you adjust? I, as a veterinarian who also does chiropractic, I can counsel them on, all right, these are all the normal traditional things that can be done for chiropractic, for a cruciate ligament. And then we can discuss whether chiropractic, remember what I said, is it beneficial, right? And is it safe? All right. Or is it not going to do anything for the problem that the owner brought in? And so I counsel them. So technically, chiropractic is not going to hurt if you adjust a dog with a cruciate, but is it going to help? And my problem is that it's not going to address the primary situation. So we get into an issue of delay of care for the cruciate problem, because the owners are bringing their animals in good faith to someone that they feel has extra education and is trying to help their animal. And so a non-DVM practitioner may tell them, go back to your regular veterinarian, but the owners get this false sense of security that I'm doing the right thing. I've taken my dog to this qualified professional. And so they may be told to go back, but do they go back? And so I do worry. And then are these non-DVMs, are they actually still adjusting?
Right.
So do you
And
walk?
honestly, if I can interject really quick, the other thing that I've unfortunately seen as well is because on the human side, chiropractors sometimes help with like orthotic fitting and stuff with people, but they're not trained to do that specifically in animals. And so I will sometimes see chiropractors that don't fully understand that that's crossing a line and practicing outside of their scope when they start making recommendations on like coaptation or orthotics for situations like this as well.
Absolutely. That is definitely, they're not taught that. So part of learning chiropractic, none of that was in any of the courses. They don't have time to teach that. So they have no basis for doing animal orthotics.
Right, exactly. I think the other part too is, you don't adjust a hypermobile joint, and cranial cruciate ligament rupture is a hypermobile joint. And so there are some chiropractors that do adjustment outside of the spine. Not everybody is just focused on the spine. Some will do other, appendicular joints. And so it would require, an astute practitioner to identify this and choose not to do something. So I think it just bears kind of discussing kind of what we know, what we see, and as a referring or supervising practitioner to kind of be on the lookout for situations like this.
Right. They have to have the ability, if you're a non-DVM chiropractor, you have to have the ability to walk away and go, yeah, you know what? Chiropractic is really not going to help this right now. So I'm not going to adjust because I'm going to do the right thing. And I'm going to just send you along your way first to your regular veterinarian and get help. And even though I am a veterinarian, I do that too, because I don't do any traditional medicine. I will often see patients and go, yeah, no, you don't see me first. You can go back and then get your diagnostics or get some medication, whatever you need. And then eventually I can follow up with you.
Mm-hmm. Yep, exactly. What about the meningitis, GME example?
Yep, so that's me as well. So the meningitis, this was quite a serious case for me, and it was quite upsetting. And so there was a patient, of course, it's a Frenchie, and the Frenchie had been being adjusted for years with a non-DVM practitioner. And they were adjusting the dog, and for years the dog had been doing okay. But then suddenly something changed and the dog kept getting worse and was getting weaker and weaker in the legs and becoming paralyzed in the rear legs. And that's when this practitioner finally, they were seeing this dog weekly. And then finally the practitioner said, hey, maybe you should, get some acupuncture or something like that. And that's how I got involved. And so they asked me to come out and take a look at this dog, and I went in, and by that time the dog was fully paralyzed, all four legs. And I said, you've been seeing a chiropractor. I'm like, I'm not sure that acupuncture is the right thing right now. I don't know what's exactly going on. And I actually really did think that this was probably just a disc. They have those hemivertebrae. I thought maybe a disc had been ruptured or, was causing pressure. I'm like, let's send you to the neurologist first. I would be much more comfortable with that. The owner was all up for it and did not realize how severe this was. This dog had become fully paralyzed, no control, bladder, bowel, no, all 4 feet. Sent them to the neurologist, went in through the ER. The dog had a MRI, and they didn't find anything. They had the normal hemivertebrae for a Frenchie, but they did a CSF tap and found that this dog had meningitis. And then the dog was started on appropriate therapy, and that really hit it home for me. That it was a good thing that I did not just go, oh, this is just a disc, I'm just going to do some acupuncture because I know acupuncture can help that. But it really hit home that I had, done the right thing. And I actually had driven quite a ways. I'm a mobile practitioner, so I had driven quite a ways to this patient. And I did not get paid anything because I did no treatment. I sent them along their way. And that is what concerns me, is how many of these other practitioners that are not veterinarians will just walk away and lose all that money. I mean, we all are small business owners. Will they walk away and leave that, or would they just adjust and then say, yep, go back to your regular vet? And so this one really hit it home for me that, wow, I am so glad for that patient that I had some other knowledge in my head and that I sent them on their way to make sure I was going to do no harm.
Yes, yes, exactly. Dr. Smallwood, I believe you had the degenerative myelopathy example.
Yeah, I think we all see a lot of these cases that are either diagnosed with DM. Of course, we can't diagnose that condition in an alive patient because we need to see the tissues under a microscope to make an absolute diagnosis. But a lot of us do some genetic testing and we have an idea and we've ruled other things out. But I just find a lot of these dogs are sent either to me or have been getting chiropractic care, and the owners have not, either they haven't been educated or they just don't understand that chiropractic can help when a patient has some proprioceptive deficits and is a little bit ataxic. It can help with these issues that happen because of that, but that it's not curing or treating the actual underlying condition. And consistently, I've seen clients not have been informed of that, or they just don't understand that.
Yeah, exactly. And I think that's a big point for the veterinarians that are, considering partnering with a human chiropractor, to kind of offer this additional adjunctive care, is just the importance in really talking with the owner about like what the diagnosis is, and really kind of drilling down to help make sure that we're educating the owner in not, unwittingly kind of creating an empirical management plan around something that, that owner's not on the same page. And I think that's a really important component associated with when we start bringing in some of the holistic and alternative therapies, is that the owner has that true level of informed consent. Because if they're not fully reconciled as to like what the diagnosis is, then they need to really understand what the list of differentials are and kind of what you're looking for as a practitioner when you're starting into some of these alternative therapies. So definitely, I think that's very important. I think I have the intervertebral disc disease example. So I had a patient that, dachshund, we all know how this goes, started having some ataxia and pain, performed a rest series, and the owner was like, well, I can't have surgery, and I heard that chiropractic can help, so let me try that. And so they talked their regular veterinarian into kind of sending them to a chiropractor. And this had been after a good 8 weeks from when the original ataxia started. After 3 adjustments, the pet became unable to walk and lost all sensation in the back legs. And the owner was like, I need to find something else. This isn't working. The dog's getting worse. And so when they came in to see me here, that was the big thing that I noticed, is that ultimately the dog had been doing okay and actually making some mild improvements with the rest and activity restriction. But as soon as chiropractic adjustment was started, it just started devolving and getting worse. And so I had another discussion with the owner so that they really understood, that when a dog loses sensation of their back legs, that's an indication that we need to get them to surgery quickly. But of course, by the time they got to us, they had been deep pain negative for about 2 weeks, I believe. And still the owner just really didn't want to do surgery, so we had all the discussions about what that meant and kind of what the potential outcomes could be. So we made some medication adjustments and got this dog started on some steroids and got the rest and activity restriction kind of back in place, and started working on neurodevelopmental sequencing and inflammation and pain control to also help kind of bring down the swelling around the spinal cord and to help deal with some of the discomfort in this dog's back. And fast forward, probably another 2 months, we were able to get this dog's sensation back, and we were actually able to get this dog back ambulatory. So I think it's important to understand that if we're going to use something like chiropractic from an empirical management standpoint, I think we need to be very case selective. So even if you have an x-ray, if you're solely using that x-ray to kind of determine, okay, what regions of the spine might be safe to adjust versus which ones may not be safe to adjust, just based off of, looking for mineralized discs or looking for disc space narrowing, you might be right and you might be wrong. Because ultimately, without an MRI, you really have no way of knowing exactly what disc is creating the largest compression. I think we also have to understand too that there's a subset of these dogs that have that chondrodysplastic gene, and that's going to increase the risk of disc rupture. And so do those dogs, should they be adjusted? Should they not? So I think before we start looking at using something like chiropractic care as an empirical management for some of these neurologic cases, I think we really have to look at and unpack kind of what the known contraindications are and make sure we're having those discussions with the owner. And then Dr. Hites, did you have the ivermectin toxicity case?
Yes.
Okay.
Yes, I had ivermectin as well. So this was another case. It was a little tiny dog that had been receiving chiropractic from a non-DVM practitioner for years again. And then I ended up getting involved as an acupuncturist for another patient in this family. And so they called me out of the blue and said, oh my gosh, we think our little puppy, it's an older dog, had a stroke or something, is suddenly ataxic, is not doing well, and the chiropractor's not available. What can we do? And so I went over and I took a look at this dog, and I actually started asking questions, and I was like, well, what have you given anything lately? Because I started thinking about, well, this could be a toxicity too. This is a little dog. These people live on a farm. So I started thinking about this, and they actually had dosed this dog with its normal ivermectin 12 hours before all of this started. And so I started thinking, well, this could be ivermectin toxicity somewhere in my brain. I remembered through my many years of training, many, many years ago, that I'm like, well, I think that this can cause neurologic symptoms. And so I had to look it up. Fortunately, we have that at our fingertips now. And so I looked it up, and then I had to figure out, how do I tell the difference between a stroke and ivermectin toxicity? And there are actually ways. And so and just with a physical exam. And so I was like, no, I really don't think this is a stroke. I did my normal physical exam. I'm like, I really don't think that your dog needs anything except, let's not give it any more ivermectin. And they said, well, why is this happening? And what I have found with a lot of our medications as these dogs get older is the blood-brain barrier is supposed to be very complete and intact. But as we get older, just like with people, it becomes, a little Swiss cheesy at points. It gets a little thinner, and there are certain drugs, especially if you end up getting an overdose of something, that it can go across the blood-brain barrier a little easier. And so this patient actually had ivermectin toxicity. And again, this makes me think, wow, I'm so glad that I had that extra, teaching somewhere in the depths of my brain that I actually thought about asking. And that is one of the things, because I did go through options for animals, granted many, many years ago. But they touch on these things for the non-DVM practitioners, but toxins there's many, and they have changed over the years, and they continue to change over the years. And so that is part of the education that I am concerned about, is that does a non-DVM practitioner have enough knowledge to be able to, if they had walked in and saw this, would they have thought to ask the questions that I asked? And so again, this was another one where I didn't do treatment because it was not going to be beneficial to this patient at that point for that disease. So,
Okay, thank you. So just to kind of piggyback on that discussion a little bit, this is a kind of abbreviated subset of a document that I researched to help with kind of creating for a reference sheet for veterinarians and just really looking at what we know as far as like actual documented precautions and contraindications. So those things that were listed specifically associated with chiropractic adjustment, so very specific to that type of joint mobilization, like you can see listed here, you know, acute disc herniation, any disc herniation. Spinal deformity is a big one because often if you have an actual like vertebral body deformation, you can also have underlying spinal cord deformation as well. So if you kind of think about not necessarily just the Frenchies or the pugs, but those kind of normal dogs and cats where they have this block vertebrae that develops, you know, usually somewhere through the lumbar spine. Some of these animals will have kind of a double bunny hop type of gait that is imperative because it's an adaptation that the body has that creates almost like a timed double withdrawal reaction that creates this bunny hop type of gait. And it's associated with the spinal cord deformation along with that kind of fused block vertebrae that also forms. You know, things like degenerative joint disease, because we have, you know, far more friable ligaments. You know, it's not that it's a disease just of the joint cartilage, but it also does affect some of the, you know, other connective tissue structures around the joint and inside of the joint. Autoimmune arthropathies. If there's an erosive arthropathy, then all of those tissues that are holding kind of that joint together, the integrity of all of those are going to be compromised. With spondyloarthropathies, you've got some bridging and some fusion that's occurring. And so those joints can't actually move at all. You know, certainly radiculopathies, if you've got any type of, you know, necrosis, metabolic disorder, obviously vertebral malignancies, other bone diseases that can weaken the bone. So if you guys just kind of look through what we actually know are contraindications to chiropractic adjustment, I think as veterinarians determining if this is the right avenue to go with their patient, at the very least screening your patients for these types of conditions would be important. And then just educating the owner as to like why or why not you feel like it would be safe for them to seek chiropractic care. This is the sources for these contraindications. So on the human side, they have physical medicine. They're also known as physiatrists. And so they have a wealth of information. There's also WHO guidelines on safety and basic training in chiropractic. And then also from the physical therapy side, there's some other publications. So these are very well documented contraindications from some pretty high level medical professionals. So I think ultimately, if those reputable leaders in healthcare consider them contraindications, then why do we hear that sometimes these conditions can be listed as benefiting from chiropractic? So let's talk a little bit about like how a chiropractor may look at this. So they may consider adjusting at versus around. So when you have a region of the spinal column that's fixed or diseased, you know, maybe it's not best practice to adjust directly at that site, but there is potential benefit to helping keep the remainder of the spinal column functioning properly. So, they may take an adjustment around type of approach. Now, ultimately, to be able to do that, you really need to know like what's happening with the spinal column and that there is a disease present that we need to kind of avoid direct adjustment for. I think we need to look at our practitioners' personal philosophies. With the chiropractic philosophy, dis-ease is kind of a potential source for all disorders. If there is a subluxation in the spinal column creating vascular and neuroanatomical interruption because of the visceral connection to that spinal segment, that can potentially start to disrupt normal metabolic processes that then result in the development of disease. And so that's a big thing that they look at, and ultimately, if you want to help with kind of preventing of spinal subluxations, kind of contributing to the development of a disease disorder, you really need to identify that early and deal with that on a regular basis. And that's where chiropractic really shines, is helping to maintain health, helping to try and kind of alleviate any of these subluxations early before disease occurs. I think looking at our, clinical decision-making, is the chiropractor that you're working with, evidence-based? Are they subluxation-based? Do they, make treatment decisions based off of chiropractic neurology versus a Gonstead principle? So if you start diving into the human chiropractic world, you'll realize that there's almost somewhat these factions of different clinical decision-making. And so that can be a little bit confusing if you as a veterinarian don't fully understand, the practice philosophies and principles of the chiropractor that you're partnering with. And so I think it's important to really get to know like who it is that you're working with. When we're talking about, the non-vet animal chiropractors, we're talking about that we're supervising them. That's the way that the law is currently. And because they're not veterinarians, they shouldn't have that direct access because they don't have the veterinarian's educational foundation. So technically what we should be writing is a prescription. And I think we need to ask ourselves, with our relationship that we have with our human-based animal chiropractor, will they follow the prescription? Can they follow a prescription? Can they find a core issue? Is it always in the spine? I think a lot of it is that we need to understand all of our diagnostics and understanding why this is happening needs to happen before we start to ask for a chiropractor to come in and kind of help out with a case, because they're not educated on specifically finding the why, and if that's what you're looking for from them, then, I think your patients may not be best benefited by that relationship. I think it's important too to understand that in the human chiropractic realm, they do have a subset of physical rehabilitation that is not included when we talk about animal chiropractic, because we actually have a board certification in veterinary medicine for sports medicine and physical rehabilitation. So I think we need to kind of look at the differences here, right? What our legislation says and how that kind of informs the professional practice. So when we say chiropractic, we're talking about human chiropractic and the legalities and the definitions and the education and just the breadth of what they incorporate as, their scope of practice, versus animal chiropractic, because animal chiropractic has its own definition. So on the human side, it's that occupations code 201. And so ultimately it encompasses a lot of things. And so it's important to understand that all of this is very specific to humans. And that's a completely different industry than what veterinary medicine is. So in humans, they are allowed to use needles as long as it's non-incisive or non-surgical. They do use electrodiagnostics, immobilizations, laser. They do homeopathics, they do botanicals. But on the animal chiropractic side, that's defined through our occupations code 801. And so when we're talking about animals, it has a very specific definition that does not include the vast majority of what it includes in human. So I think it's important that we as veterinarians kind of understand where that line is as far as like the scope of practice. Because, you know, if you're going to supervise the care, you know, you don't want somebody taking a lot of liberties with your license.
Okay, thank you. And just to kind of reiterate what Dr. Barton went through in her previous slide, it can be really confusing because there's lots of technicalities here. And certainly before I started looking more into this, I was not aware of all of them. So we're going to try to make this as concise as possible, but also shed a little light on this. I know we all took a jurisprudence exam, but mine was a long time ago. So I didn't necessarily remember all of this. And, you know, the Licensing Act, where that Texas Occupations Code is found, is statute. So that's law. And law requires legislation to change that. So what Dr. Barton was saying about the definition of veterinary chiropractic, that is law, and that would require legislation to change. When we talk about the rules, that sometimes we call that the code or the admin code, but that can be changed by the Texas Board of Veterinary Medical Examiners, but it can only be changed to the extent to which the wording in the statute allows it to be changed. Back to that occupations code, the portion of the code that kind of pertains to veterinary medicine is in 801. And the language, this is obviously a very small part of it, but here it is. It talks about alternative therapies, and chiropractic and acupuncture are considered alternative therapies in veterinary medicine. And so if you read this little portion right here that we took out of it for you, and also laser therapy, are performed only by a veterinarian in the state or under the supervision of a veterinarian. And that's really, really important to understand.
Yeah, and this is the portion of the occupation code that gives our veterinary board of medical examiners the power then to say, okay, the state legislation says these things are under veterinary medicine, and it calls them out by name. And then our vet board then kind of develops the definitions and some of the rule detail for us to then follow.
And so again, the rules, 573 talks about alternative therapies. And so this definition kind of goes through how it's defined here in Texas. But if you skip down to the bottom there, animal chiropractic and other forms of musculoskeletal manipulation in non-human animals are considered to be alternative therapies in the practice of veterinary medicine here. So that's important. They must be done by a licensed veterinarian or under the supervision of that veterinarian. If a non-vet employee or an independent contractor is doing those, they must be done under direct or general supervision, and the owner must sign an informed consent form. And those consent forms must delineate that this is an alternative practice and explain what that is.
Yeah, and I think the big thing here is understanding that it is the supervising veterinarian's responsibility to actually gather that informed consent. So that means that if you're going to, work with a human chiropractor, that you recommend chiropractic and you're comfortable with providing that supervision, you are also responsible from gathering that informed consent from the owner so that they understand that animal chiropractic is a form of alternative therapy.
And keeping it on file.
Yeah, and I just want to add with the state board is kicking up their inspections. They've got additional funding and travel budget, and they've hired new inspectors. They are going across the state inspecting vets, and one thing that they are always looking for is to see if you have those forms.
Yes, exactly. If they know that you supervise, recommend any form of alternative therapy, or if you provide any form of alternative therapy, that is the first thing that they will ask you for, is copies of the informed consents.
And then kind of once we know all of these things that we just learned, Dr. Barton talked about this earlier too, but really thinking about if we are going to sign forms and allow others to work under our license, we need to really be thinking about that as a prescription, not just permission to work under my license. Because if we were going to write a prescription for a medication, it would be very specific. There would be all sorts of details, route, strength, length of time, number of refills, things like that. And we really need to be thinking about these permission forms, whatever you want to call them, not as permission forms, because there are many more details that go along with this. And we need to protect not only the health and safety of our patients, but we also need to be thinking about our licenses too, because it's our liability. I don't know if everybody has gotten asked to sign these, but the ones that I've gotten asked to sign are sometimes they have some misleading words in them. Sometimes there's just a misunderstanding about what they are. And it certainly can create a difficult conversation with the owner as to why you may or may not want to sign these, or why you might want to change the wording in them. But it's a conversation that you really need to have with the owner. And in my experience, I have found that the owners are very appreciative because they don't understand what they mean. And so we've included some examples here. Dr. Barton, is this an example that you've included here, or which one is that?
So these are all the examples. So I think every veterinarian has probably gotten one of the forms, if you will. And so I kind of reference them as the vet clearance or the referral or the consent to treat form. And ultimately, these are not in the best interest for veterinarians to just sign off on, because one of the things that I have definitely noted is that the human chiropractors don't actually fully understand the law. And so they don't fully understand that really the liability stays with the veterinarian. And so as a veterinarian, you need to be looking at like this patient, what's going on with them. Do they have a disease disorder? Is this the best avenue for them to go? If you're comfortable, with them having chiropractic performed and the owner understands like that you guys are trying this from an empirical standpoint, like what do you want done? What do you want not done? When do you want to see that patient back? So they reference these as referrals, and these are not referrals. Veterinarians can only refer to other veterinarians. That is the only way that you transfer professional liability. So these are actually supervision forms, and they're not just clearance forms. And so this is a form here that doesn't really state exactly what you're using the alternative therapy for. And so that's why I'm saying, like, if you'll look through some of these different forms that we receive, they're not necessarily clear. They're not necessarily complete. They're not necessarily true. And so I think that's an important thing to understand. And maybe instead of signing their forms, that maybe we need to be coming up with our own prescription style form.
I 100% agree. And to your previous point, I think that because the definition of chiropractic in the human world is different, and it includes some other things than it does in the veterinary world, it's extra confusing. And I think it does sometimes really create a problem here with these forms, because I don't think that a lot of the non-veterinarian chiropractors necessarily are aware of that. And so these forms oftentimes are pretty vague, and then they start doing some other modalities like laser and things like that they really don't know that they're not allowed to do. And we don't even know they're doing them, or wouldn't know, because it wasn't explicitly written in this form. And that can create a lot of problems.
Right,
Right,
exactly.
that's one of the things that we found when we were at Southwest. In the audience, people would ask questions, and that is one of the things that we found, is that the non-DVM chiropractors, the reason they call these referral forms is because that's what they're told in school to call them. And they are, so I don't think they're doing it in bad faith, but I think that we do need to have some education where they are finding that, yes, it is not a referral form, because that indicates that I have referred liability along with the patient and I am not needing to supervise. And so I don't think that the non-DVM animal chiropractors are understanding that. But that is a huge legality for veterinarians when they are signing these forms. So it does need to be more of a prescription, just like Dr. Smallwood said.
Right. And just as an example here, like some of these forms will say, like, I will indemnify and hold harmless this person and my treating veterinarian. I mean, just because that statement is there does not actually alleviate you from your professional responsibility. So it sometimes will give a bit of a false sense of security as to, what level of responsibility you're taking on. And so when we are seeing this is part of why we wanted to do this webinar, so that our general veterinarians would kind of understand how to maybe reframe this supervisory type of, relationship or responsibility. Again, I don't think that the chiropractors are trying to, pull anything over on us. I do think there's a lot of confusion out there, and it stems from the inconsistency in the education programs. Some of these education programs, they have people who are attending from multiple states, and each individual state is going to have their own legalities associated with this practice. In some states, animal chiropractic is under the chiropractic board and not even under the vet board. The vast majority of the states, though, it is under the veterinary code. So it's important to kind of understand that I would take these forms with a grain of salt and really see if it kind of jives with what we understand legality wise for Texas. Another thing to also kind of watch out for, Dr. Smallwood and I both got this flyer from a human chiropractor, freshly IVCA certified, and she clearly does not understand what the scope of practice entails. Because in the flyer, she's saying that she can perform radiograph imaging, blood work, prescriptions, diagnosis, physical therapy, cold laser, dietary care. All of those things are completely outside her scope of practice, 110%. And she cannot do those things. But yet these are the flyers and, the things that she's handing out to vet offices. And so that's part of why we wanted to kind of really talk about this and kind of talk about the language used on some of these forms, so that you guys can kind of decide like what you're comfortable with.
And I'll just add to that. I do think, I think the knee-jerk reaction is to just say, yes, I'll sign it, or no, I won't. But I think we really owe it to our patients and our clients and our colleagues and even the chiropractors to have this conversation about, this is why I'm signing it. This is why I will sign it with these changes made. This is why I won't sign it, rather than just cut off a communication, because we all want what's best for our patient. We don't want to disappoint people, but we need this conversation, because there's a lot of ambiguity and a lot of confusion around the subject. So I would just encourage everybody to really have this conversation with the client about what your decision is and why you're making it.
Mhm.
Right. And we were kind of surprised in our work group to find that many veterinarian colleagues did not understand when they were signing these forms that they were still legally liable and that they were supposed to be supervising this care. And so this was part of why we're doing this webinar, and why we gave our talk at Southwest, was to make sure that our colleagues are aware of what the legalities are.
So yeah, again, it is your license. So we're certainly, it's your choice how to do this, but you do have options, right? You could sign them the way they are. You could present your own option with wording. But we just really want you to know it's your license, and the liability falls on you.
And decide kind of what your take is on it. What are you comfortable with, right? I think chiropractic in animals shines when you're using it early as part of a regular body care maintenance type of approach. I think we need to be far more careful, though, if we start considering it an empirical management strategy for mobility and pain disorders. I think that's where, as a practicing veterinarian that works within, acupuncture, physical rehabilitation, and animal chiropractic, I've seen some of the biggest disservices done, because the owners really weren't properly educated as to what was likely going on with their pet. And, they were just too far gone with, chiropractic stuff, and it's not really helping. And in some situations, it's actively hurting the condition that much more. And if we're going to choose to use it as an empirical management, man, call it back and write a prescription that says, okay, we're going to do this for this amount of time. I want to reassess the pet at this time, so that then you're staying connected with that client, with that patient, to determine, okay, is this empirical management route really working for this pet? And don't forget to get your informed consents. That's the other alternative. The other alternative is to refer
to a veterinarian.
Exactly. Because that's a true referral. And that's the only referral that exists, is if you're referring to another veterinarian. Because right now, as it's written, otherwise you are supervising.
So this is a topic that came up really in earnest last session, because there was a bill filed by Representative Kitzman. And essentially what it did is it said that if you are an AVCA or IVCA certified human chiropractor, you would be allowed to, it removed the supervision requirement that's currently in statute. So it said if you were one of these human chiropractors with these certifications, you could practice on animal patients without any type of veterinary supervision. That was a problem for many of the reasons that you saw laid out by the doctors in this presentation. One other aspect of that bill that was problematic was that there was no regulatory oversight of any kind. So the chiropractic board that regulates human chiropractors, they only regulate the practice of chiropractic on human patients. And the vet board that regulates veterinarians does not regulate anyone other than veterinarians, LVTs, and equine dental providers. So they were would have been, had that bill passed, they would have been operating in this space with no regulation of any kind. So that bill did not succeed last session. We were able to successfully fight that off, but we do think that there's going to be some legislation coming in some form or another this session in 2025. And that's why it's so important that veterinarians understand how all this works and how it works currently and what the proposed changes would do, so that we can engage and make sure that whatever ends up coming out of this session is in the best interest of the public and their pets. So that's kind of where we are right now. We're just kind of waiting to see going into next session. And I think that's pretty much the end of the legislative update for now. Do y'all have anything that y'all want to touch on before we sign on?
Yeah. So in discussing the legislative, changes, I think we as veterinarians have to kind of return back to what's the education level of these individuals seeking to have direct access to animals, because it is an alternative type of veterinary care. So, it is veterinary medicine, and a veterinarian who is additionally educated in some of these alternative realms, I just see them do nothing but grow larger and better as a practitioner. But what does it look like if you take somebody who's foundationally educated in a completely different industry? Is that 4 equivalent credit hours enough to give them direct access to animals? And I think if the answer is no, you don't think it's enough, then we really need to be active in this discussion. I think for me, yes, I'm biased, because this is the kind of patient that I see. When we start talking about the spinal malformations, we have a large number of these in veterinary care. We breed animals, and we choose animals for a very specific phenotype with unintended consequences that come along with those too. And it's important to kind of understand what education is out there when we're talking about the chiropractic side of things. And when you look at this, the line of correction or that contact point that Dr. Hites had kind of talked about way back at the beginning of the presentation would be this little process right here. And so the typical taught line of correction is going to be kind of at a 45-degree angle. So if you look at a 45-degree angle off of this here, you're trying to, push into this direction, and you're going to just jam that right into this other vertebral body. So without the ability to read x-rays, how do you make a clinical decision how do you make a clinical decision as a practitioner as to could you, is that the right avenue to take? Furthermore, when we look at this same dog in another plane, the malformation has that spinal column and that spinal canal directly facing up. And so now you can look at how a contact point would be vastly changed in this patient. So we can't forget that when we're talking about making decisions in animal care and who has access to what, that we have to talk about all animals. So large animals, we didn't really hone in on too much in this discussion, but they're included as well. Cats are included as well. All exotics, right? All livestock. All of these things would be included in that access. And is that appropriate? And is 4 hours of additional education enough to have direct access? And so I think that's what we have to ask ourselves as veterinary practitioners. Certainly we need to know it whenever we're looking at supervising this, but we also need to understand what part of the conversation is and should the legalities actually change or not. So these are the patients that I think I try to speak on behalf of. This is the same dog, able to walk, right? Obviously not a normal skeletal structure by any means, but these are the patients that we care for as veterinarians. And so I think that's why it's important that we speak on these patients' best behalf. All right.
Right. And I know that we talked a little bit about the different you know, the education. And I think it's important that we realize that all those different schools, they have a base, but they are not all the same. So I know that Options and Healing Wellness Oasis are race approved. And so those are truly, you know, are going to be held to a different standard. But still, they're not teaching you everything. They cannot possibly for a non-DVM practitioner. So I worry about zoonoses. I mean, I think about rabies. I do a lot of hunting dog trial dogs, and I had one, the lady was like, dog was fine, suddenly neurologic. First thing out of my mouth was, when was your last rabies shot? It was just a knee-jerk reaction, because my job as a veterinarian is to not only protect the animal and help the animal, I have to protect the public, right? I mean, that is part of our job, is to protect the owner. And so, and that's just one of the examples. You can think about leptospirosis, brucellosis, I can't even think of, tularemia, hantavirus. You think about all these things, and I worry about the non-DVM practitioners as well. They may get exposed to these things, and now I've got owners and their family, and so I worry about the amount that they're taught. I know that, yes, they have a small section about zoonoses, but think about what we were taught about zoonoses, and they're ever changing, right? So I do worry about the zoonoses, the toxicoses, you know, that can be happening. One of our colleagues shared about a horse with EPM, and they were being adjusted, and it did not help, obviously, because the the horse needed something else. So, you know, I worry about those things, and I worry about the owners not being informed. And that is the problem, is that if the non-DVM practitioners want to treat animals, that's fine. It has its place and we welcome them, but there has to be some type of oversight for them to make sure that they are protected, our people, our owners are protected, you know, and our animal patients are protected. And that's what it comes down to.
And I think ultimately too, it's one thing if we're helping to kind of just raise an awareness of some of the different zoonotic diseases, but if these educational courses are going to try to educate those from outside of the veterinary industry to be able to practice autonomously within a subset of the veterinary industry, there has to be a lot more that's looked at, because they don't have the training to read radiographs. They're not going to be able to diagnose a discospondylitis, which is one of the more common ways that brucellosis can show up. I've had 2 patients that both had brucellosis that manifested as discospondylitis. You know, if they're going to have direct access, they also need to have the independent ability to see and diagnose and recognize these disease disorders. And that's not really how the foundational education programs are created. They're not created to do that. You can't teach all that in 4 credit hours worth of additional education.
Right. And they may say, yes, we have been trained to read radiographs, but those are human radiographs. And the animals are so different, and we have so many breeds and species, you know, to read. So it is quite different.
Yep.
If anyone ever has any questions, we're always here. You can always ask us questions. We're wide open to answer.
And I believe, Trent, you said you were going to add some of the attachment documents in the legal center on TVMA.
Yeah, so we've already got some of those up on there, and we'll make sure those are there. And if you have any questions or follow up for any of these doctors, just contact me. TVMA 610-6656 is my direct line, and happy to help y'all out.